Let's try to understand the movements of the eyeball produced by different muscles. First of all, we have to look at the orientation of this model. So this is a model of the eyeball of the right eye. So if you can see on the skull, this is the right eye, which means this part is the medial part of the eyeball, and this part is the lateral part of the eyeball. And this arrow represents the upper part, and this is the lower part. So once we have oriented ourselves with this eyeball, the medial from the lateral and the upper from the lower, we also need to know this imaginary line that you can see here that runs all the way through. This imaginary line is called the equator, and this divides the eyeball into an anterior part, anterior half, and the posterior half. And this will be of importance when we talk about the muscle attachments. Okay, so remember, this is the right eye. Okay, so the next thing we have to see is the muscle attachments. So as we know, there are 7 extraocular muscles. One of them is associated with the upper eyelid, which is the levator palpebrae superioris. So excluding that, the remaining 6 are controlling the different movements of the eyeball. So the 6 muscles are represented over here. The yellow ones are the recti muscles. So we have over here the superior rectus, the medial rectus, the lateral rectus, and the inferior rectus over here. And these the ones with the red pins are the obliques. So this is the superior oblique muscle and the inferior oblique muscle. Okay. First, let's see where are the recti muscles attached and where they originate from. So as we know, the 4 recti muscles originate from the common tendinous ring, which is situated in the lower part of the superior orbital fissure. And the muscles from the common tendinous ring extend forward and attach on the eyeball. One important thing to note is the fact that all the 4 recti muscles are attached to the anterior part of the eyeball. Remember this equator that we were talking about that divides the eyeball into an anterior half and a posterior half. So all the yellow ones, which are the recti muscles, are attached to the anterior part of the eyeball. So they're attached anteriorly. Another interesting thing to note is the difference between the axis of the eyeball compared to the axis of the orbit. When we talk about the axis of the eyeball, so this stick or skewer is representing the axis of the eyeball. It's an anterior-posterior axis going from the anterior to the posterior of the eyeball, directed forwards, straight forwards. But when we talk about the axis of the bony orbit, so this is the bony orbit of the right eye, and if we imagine its axis by putting this stick right in the center of this orbit, so as we can see, the axis is directed from posterior to anterior. It's going laterally, anterior and laterally, whereas the axis of the eyeball is directed straight anteriorly. So the axis of the orbit is like that, and the axis of the eyeball is straight forwards. And remember that the origin of the 4 recti muscles is from the common tendinous ring. So that's why the muscles, when they originate, they have to travel anteriorly and a bit laterally to attach on the eyeball, as we can see right here. So imagine it like this, and that's why when from their origin, from the common tendinous ring, the muscles have to travel anteriorly and a bit laterally to come and attach on the eyeball. So notice how the 4 recti muscles are directed in this, they're not straight like that, but they are a bit tilted because of the difference of between the axis of the eyeball compared to the axis of the bony orbit. Okay, so now for the two obliques, the superior oblique and the inferior oblique. Now for the superior oblique, we know that it originates just above, a little superior to the common tendinous ring, and from there it is attached to the trochlea on the medial part of the orbit. And then from the trochlea, it extends forward and attaches on the eyeball. Now, why did we show only this part of the superior oblique muscle over here on this model? The reason is that when we talk about the muscle movements, the movements produced by the different muscles, this is the part of the superior oblique that we are concerned about. Because the trochlea actually fixes the muscle at this place. The trochlea over here fixes the muscle over here. So only the part after the trochlea is of significance when we talk about the movements, and we'll understand that later. So, okay, so for the superior oblique, also notice how it is attaching posterior to the equator. So it's attaching to the posterior outer quadrant of the eyeball. Now let's have a look at the inferior oblique. So I turned the eyeball like this. So this part becomes the posterior and this is the anterior. So the inferior oblique is also attached to the posterior part of the eyeball, but on the lower surface, on the lower surface of the eyeball. So if you have a look at it like this, the origin of the inferior oblique is medial to the lacrimal groove, and then from here it goes and attaches to the eyeball. So it goes backwards and laterally and attaches to the posterior quadrant of the eyeball. Okay, so now the interesting thing. Notice how the superior oblique is actually parallel to the inferior oblique. If you look at them like this, they're parallel to each other. The superior oblique on the upper surface and the inferior oblique on the lower surface. Similarly, the superior rectus and the inferior rectus are parallel as well. This is the inferior rectus, this is the superior rectus. So both of them are parallel to each other in their attachments, but the superior oblique is attaching on the upper surface, and the lower oblique and the inferior oblique is attaching on the lower surface. So regarding the muscle attachments, the important thing is that the 4 recti muscles attach to the anterior part of the eyeball, whereas the 2 oblique muscles attach to the posterior part of the eyeball. So the next thing we need to understand is the axis of the eyeball. Remember that the eyeball is actually a sphere or a ball. That's why it has 3 axes. And also remember that this is the right eye, so this part is the medial side of the eyeball and this is the lateral side of the eyeball. If you can understand the axis of the eyeball, then it becomes very easy to understand the different movements produced by the 6 muscles we're talking about. Okay, so the first axis of the eyeball is a horizontal axis. Now this stick or skewer actually represents the horizontal axis of the eyeball. This axis allows movement in 2 directions. So if we tilt the eyeball upwards, this is elevation, this is depression. So on the horizontal axis we have elevation and depression of the eyeball. That's the first axis. The second axis is the vertical axis, like this. So what are the movements on the vertical axis? Remember, this is the right eye. This is the medial part and this is the lateral part. So the eyeball can rotate like this. That would be adduction. Or it can rotate like this. And this would be abduction. So on the vertical axis, we have adduction and abduction. What's the third axis? The third axis is called the axis of the eyeball, or you can call it the anterior-posterior axis, because it is going from the anterior of the eyeball to the posterior. So it's called the axis of the eyeball or the anterior-posterior axis. Now, what are the movements that can be produced on this axis? The eyeball can move inwards like this, and you can look at how this arrow is moving. If it's moving inwards or medially, this movement is called medial rotation or internal rotation or intorsion. So it has three names. This movement has three names: medial rotation or intorsion or internal rotation. And the other movement, if this arrow is moving outwards, this is called lateral rotation or external rotation or extorsion. So these are the movements that are produced on the anterior-posterior axis. So these are the three axes of the eyeball. To see how the muscles produce the different movements of the eyeball, what we can do is simply pull the muscle backwards. Just pull it backwards, and depending on which axis we have inserted in the eyeball, the movements will be very obvious. So first, let's start with the medial rectus. What happens when I pull this muscle backwards? So when I pull it, I'm just pulling it backwards, as you can see. So the movement that's being produced is adduction, right? As you can see, like this. Yep, it's adduction. So we know that the medial rectus produces adduction. What about the lateral rectus? When I try to pull it, it produces abduction. So there we go. We now know that the medial rectus produces abduction, and we can see how. You can see how, because it's the vertical axis that we have over here, and the lateral rectus produces abduction. Okay, so these are the easier muscles, the medial and the lateral rectus. Since they are a bit easy, we can try to remove them to make the model a bit simpler. Okay, so here we are. We have the four muscles remaining: the superior and inferior rectus and the superior and inferior obliques. Now let's try to understand what are the movements produced by the superior rectus muscle. So here we are. This is the superior rectus, and we'll see what are the movements produced in each of the three axes. So first, the horizontal axis, and this is the superior rectus. So what happens when I pull this muscle backwards? What movement is produced? This is elevation. As you can see, if I pull it backwards, it's elevating the eyeball. So the first movement is elevation. On the vertical axis, when I try to pull the superior rectus, the movement that's produced is adduction. So the superior rectus produces adduction. That's the second movement. And the third movement is through this anterior-posterior axis. So what happens when I pull it? As you can see, just follow the arrow. And remember, this is the medial side and this is the lateral side. So when I pull it, it produces medial rotation or intorsion. That's the third movement. So on the three axes, we now understand the movements produced by the superior rectus. It causes adduction, and it causes elevation and medial rotation of the eyeball. And all of these movements happen because of where on the eyeball it's attached. It's attached on the upper surface of the eyeball, and on the anterior half. As we can say, it's anterior to the equator. So that's for the superior rectus. Now let's do the same thing for the inferior rectus right here. On the horizontal axis, what happens? Okay, so I'm going to try to pull it. So it's obvious it's producing depression of the eyeball. On the vertical axis, it's producing adduction again, because we can see how it originates and where it attaches on the eyeball. It's causing adduction. And for the last movement, okay, so here I'm going to try to pull it. I'm just pulling it backwards. So it's causing this movement. External rotation, or lateral rotation, or extorsion. This was the confusing movement, but once we know which axis we have to focus on, we can understand what the movement is. So the inferior rectus actually causes lateral rotation. So the three movements of the inferior rectus are depression and adduction and lateral rotation, and we saw how these three movements happen depending on the axis. So the remaining two muscles are the obliques. Let's start with the superior oblique, and as we mentioned before, that the part that we're concerned about is this part after the trochlea. So after we know that it originates, the superior oblique originates from a bit above the common tendinous ring, and it comes forward, not attaches, but is fixed at the trochlea, which acts like a pulley, and then it goes and inserts on the posterior outer quadrant of the eyeball on the upper surface. So over here, if you can imagine, it's fixed right here by the trochlea. So this is the part that we are concerned with. So let's see the different movements. What about the horizontal axis? So if I pull this, it's causing depression. So the superior oblique, although it's attached on the upper surface of the eyeball, it causes depression. Why? Because it is attaching posterior to the equator, and that is very important. The four recti muscles attach anterior to the equator, while the obliques, they attach posterior to the equator, and that's why their movements are different. So again, on the horizontal axis, if I pull it, it's causing depression of the eyeball. On the vertical axis, if I pull it, it's causing abduction. Again, because it is posterior to the equator, that's why its movement is different than the superior rectus. So what happens if I pull it? It's causing abduction. What about the anterior posterior axis? On the anterior posterior axis, if I try to pull it, it's causing medial rotation or intorsion, like that. So these are the three movements. So the superior oblique causes depression of the eyeball, and abduction, and finally medial rotation. Now let's talk about the inferior oblique. On the horizontal axis, the movement that it produces is elevation. Again, because it is attached to the inferior surface of the eyeball, and that also posterior to the equator. So when I pull it, it's causing elevation of the eyeball. On the vertical axis, when I pull it, it causes abduction. Again, if I pull it, it's causing abduction of the eyeball. And you can see how it's attached relative to the vertical axis. When I pull it, it's simply causing abduction. And for the anteroposterior axis, so when I try to pull it, it's causing lateral rotation, or external rotation, or extorsion. So this is the movement produced on the anteroposterior axis. So the three movements that are produced by the inferior oblique are elevation, abduction, and lateral rotation. So it all depends on where exactly the muscle is attached on the eyeball, whether anterior or posterior to the equator, or whether on the upper or the lower surface. So if we understand the three axes and the muscle attachments, then we can understand the different movements of the eyeball. Thank you.